Okay, this is what lower cross syndrome is. It is a simple way of talking about and doing the X-like pattern. So the X-like pattern actually comes in where we say the following. You would have an X-like problem, just like this, where the front of the body is pulling down and the back of the body is pulling up. These two things are where it is tight. And then it would be weak in the other places. So weak there. And this weakness that you have causes the pelvis to turn down this way, causing it to be something called an anterior pelvic tilt, or what I like to call cheerleader butt. Sometimes it happens just where you stick your butt out the back. What that means is there's going to be pain right in the center. The pain is right typically there in the low back. Okay, sometimes it can be in your hip as well. The muscle that we're really having to deal with is actually on the front of the quads, and there are 4 of them. You can look at each one. Each one of these is all ones that we need to pay attention to, okay? Not the sartorius, but all of these are really important ones, and they're going to pull the pelvis forward. The guys on the back of the low back muscles here, those ones get really tight. So those are the tight ones. It's tight on the back, low back, and pulling upward, and tight on the front, pulling down, causing this pelvis to have a forward or anterior pelvic tilt. Now, the weak ones, and what's really important is the big glute muscles, which are on the back side, of course, along with your abdominal muscles. When those are weak, then we have this forcing forward anyway. So the lower cross syndrome is weak abs, weak glutes, tight quads, tight low back. So if you get your butt muscles stronger and you get your ab muscles stronger, you'll have a lot better condition with the lower cross.